Hi everyone. In today's session, we'll discuss about the heart attack, its causes, and preventive measures needed to avoid the heart attack. Nowadays, we often come to know that the person died due to heart attack even at the age as young as 30 to 40 years. Incidence of heart attack and number of deaths due to it are consistently increasing in India. So let's understand what is heart attack and what can be the reason behind it. Heart is the most essential organ and its non-stopping function is crucial for survival. It functions like a pump and allows the circulation of the blood throughout the body. Blood circulated through the extensive network of various types of small and large blood vessels. Blood ultimately provides all the nutrition and oxygen supply to the various organs which are necessary for normal functioning of the particular organ. The muscles of the heart continuously contracts and relaxes to pump the blood into the blood vessels. The pumping of the heart leads to what we can hear as a heartbeat. On an average, in a healthy normal person, heart beats for 72 times in 1 minute. This means the heart muscles contracts and relaxes 72 times every minute. To do such an extensive work non-stop without any interruption, it requires continuous supply of oxygen. For this, the heart has its own network of blood vessels around it, which continuously supplies oxygen to various heart muscles. Any interruption of blood or oxygen supply to the heart for even few seconds can impair its function, leading to heart failure or heart attack. Basically, the heart attack occurs when a blood vessel supply to the blood to the heart are blocked. Now let's understand why there will be a blockade of blood vessels. Main reasons behind such incidents is increased blood pressure and excess of cholesterol and fat deposition in the blood vessels. Persistent high pressure damages the blood vessel by making them more rigid and by damaging their inner wall. This increases the risk of cholesterol or fat deposition in the blood vessel. When there are excessive fats, it gets deposited in the inner wall of the blood vessels. It blocks the blood flow. Due to these blockades, heart of the person with high blood pressure has to work harder to pump the blood throughout the body. This increases the workload and oxygen demand of the heart. The increased demand and lower supply of the oxygen due to the blockade ultimately leads to failure of the heart function. A heart attack may cause multiple symptoms. Chest pain is the most common symptom of the heart attack. This can feel like an uncomfortable pressure, aching, numbness, squeezing, fullness, or pain in your chest. This discomfort can spread to your arms, neck, jaw, or back. It can last for several minutes or come and go. However, it's not the only symptom possible. Possible symptoms of the heart attack are dizziness or fainting, lightheadedness, nausea, indigestion, vomiting, shortness of breath. These heart attack symptoms can be different from each person. No two heart attacks are the same even for a same person. Persons may have just one or a combination of the symptom. Sometimes the symptoms of heart attack are not the classic crushing chest pain that one thinks of. One may feel less obvious symptoms such as burning feeling in the chest and shortness of breath. Sometimes one may have no warning signs, symptoms at all. A heart attack is a medical emergency. A heart attack can only be diagnosed by a medical test. The only way to know what you are experiencing is to seek urgent help. Medical tests include ECG, electrocardiogram. This can provide information about the extent and location of the heart muscle damage. It also detects the heart rate and rhythm, whether or not is having an heart attack. Next is echocardiography. It is an ultrasound test that can be used to learn how the heart is pumping overall and what areas might not be the pumping normally. Next is a coronary catheterization. It's nothing but an angiogram. It is an invasive test performed to directly visualize the size and extent of the blockade in the blood vessels of the heart. It is frequently recommended in the first hour of the heart attack if medications are not relieving the symptoms. Blood test, overall, all this, and next is a blood test. Overall, all the tests will also measure the amount of damage caused to your heart and the best treatment course to take. A heart attack may mostly requires emergency treatment to restore the blood flow to the heart. The faster this happens, the less the heart muscles is damaged. Heart attack treatments may involve medications or surgery. Medications can be drug therapy aims to break up or prevent blood clots, stop platelet from collecting and sticking to the plaques, stabilize the plaque, and prevent more ischemia. Take these medications as soon as possible within 1 hour from the start of your heart attack, if possible, to limit the heart damages. Drugs used during a heart attack may include aspirin, to stop the blood clotting that may take the heart attack worse. Other antiplatelet drugs such as clopidogrel, prasugrel, ticagrelor to stop the clotting. Thrombolytic therapies. These are the clot busters to dissolve blood clots in your heart arteries. Any combination of these. Other drugs given during or after the heart attack help heart work better, widen your blood vessels, lower your pain, and help you avoid life-threatening heart symptoms. Drug therapy aims to break or prevent the blood clots, stop platelets from clot collecting and sticking to the plaque, stabilize the plaque, and prevent more ischemia. Take these medications as soon as possible within 1 to 2 hours from the start of your heart attack if possible to limit the damage. One can reduce their risk by making positive changes in your lifestyle, such as treating of the blood cholesterol. Foods higher in saturated fats can contribute to high cholesterol and reduce the blood flow and increase the risk of heart attack. Hence, it is important to start the heart healthy diet to reduce the risk. Limit food high in saturated fat, which comes from the animal products such as cheese, fatty meats, and dairy desserts, topical oils, and highly processed foods. Choose unsaturated fats which don't rise cholesterol level. One can find unsaturated fat in the food like nuts, fish, vegetable oil, olive oil, and sunflower oil. This diet emphasizes the increased intake of fruits, vegetables, whole grains, poultry, fish, and nuts, while curbing the sugary foods and beverages. Eating and drinking too much sugar raises the triglyceride levels. A healthy heart eating plan can help manage the blood cholesterol level. Next is controlling high blood pressure. Drinking too much of alcohol can raise your blood pressure. It also adds extra calories which may cause weight gain. Cigarette smoking also raises the blood pressure and put you at higher risk of heart attack and stroke. Excessive salt intake is also known to raise BP. Reducing these factors can help to reduce the further complication of it. Following an exercise plan and maintaining an ideal body weight. Regular physical activity makes your heart stronger. If one have too strong and healthy heart, it can pump more blood with less effort, reducing the risk of hypertension and heart failure. Exercise cuts bad cholesterol levels and raises the good cholesterol level. One can aim to get 2 hours and 30 minutes of moderate aerobic activity per week, like brisk walking, or 1 hour and 15 minutes of high intensity exercise, such as jogging per week. Monitoring stress levels and getting adequate sleep are also possibly the best way to prevent the heart problems. It is important to remember that we can afford everything, but nothing is as precious as the health. It is possible to make heart healthy and prevent heart failure or heart attack through lifestyle intervention like dietary modification and exercise. By taking action to lower blood cholesterol, one can help protect themselves against heart attack. Thank you.